The CDC has issued a health advisory urging state and local authorities to watch for cases of hepatitis in children with adenovirus infection. 9 hepatitis cases in which children tested positive for the virus have occurred in Alabama since October among children ages 1 to 6. We have Dr. Greg Silverman here with us live, joining us to discuss. Good morning, Dr. Silverman. So good to see you this morning. So what do we know so far about the possible association between pediatric hepatitis and the adenovirus infection?
Right. Well, it turns out that there has been in the United States about 9 children who are under age 10 who have the adenovirus, which by and large is mostly an upper respiratory tract infection, but also have had liver disease. And turns out that about 9 of them have had to have liver transplants. This is not just a United States problem. This is also a England problem, an Israeli problem. I mean, we've seen this adenovirus in other places acting similarly. And that's why the CDC has recommended it. It's unclear exactly at this point what the correlation is. Usually you just get the upper respiratory tract problem and it goes away after 4 or 5 days. This one, for whatever reason, is also affecting these children's livers.
Has this been found more in with children with immunocompromised children?
Well, no, it actually looks like these are just in regular kids. These kids aren't children with underlying problems, which is what makes it a little bit odd, because all of the other things that we've been going through over the last 2 years with the coronavirus has been basically people who have other comorbidities. They're people who are otherwise sick. This one, it doesn't look like that. They haven't found quite a correlation between how this virus works and what the liver disease problem is. It used to also be that we would be really careful about giving people Tylenol, giving children Tylenol during certain viruses, because the Tylenol can have an effect on your liver. And I looked into this, and right now there's not quite that correlation yet. It's unclear.
Are these cases contagious?
I'm sorry?
Are these cases contagious?
Well, yeah. Well, the liver problem is not, but remember, the adenovirus is just a regular virus that kids get. I mean, it's a type of virus where you get it anyway. You generally just kind of get over it. Most kids get over it. For whatever reason, this one also is associated with the liver problems.
Dr. Silverman, thank you so much for joining us this Monday. We'll look forward to seeing you again next week. If you have a question for Dr. Silverman, text it to the number on your screen, 361-855-6397.